Well, greetings again. This is Dr. Bill Wyatt, and I want to come in this afternoon, or this morning really, and talk to you about this long-term non-double jaw surgery. We are preventing this type of surgery with a technique that we started taking out lower 6-year molars, and where they had second and third molars on the bottom arch, where we couldn't do this, or we didn't have the wisdom tooth back here to bring it up. And this has so many possibilities, and we did this case, and it's going to be 37 years since we started the case, and I'm going to show you the lady now. She has been a hostess in Southwest Airlines for years now, and she was still there the other day when we got these last pictures on her. And if this is something that really works, and I've got a whole string of cases we've done this on, and it's worked on every one of them, and I don't find anything wrong with this case that can't be that's said is something that's wrong with it. And so let me go over this and show it, and take this and check it out wherever you want to. So if it is true, it's going to affect this surgery that is done on class 3 cases all over the world. Many of them will not have to be done like they normally do. Now, I don't want to create any fuss with surgeons. I have so many that I've helped that have helped me really over the years, and I've actually scrubbed in with them and gone in and helped do some of this. So let's get started, and I'll show you what we're going to be involved in here. I'm going to start out. This young lady came to me, and she had a class 3 problem, and she had been to 2 surgeons, or at least, and maybe there was 3, I'm not sure, and they all wanted to do the top and the bottom jaw, which was the correct way to do the surgery, and she didn't want this done if possible. And so I had done some of this work where we had done the 6-year molars before this case, and so I said, I think we can do this. You look at it here, and you can see the lower jaw is extending out, and it needs to be added up into this right around the nasal area. It needs to be brought out and filled out better. And so I went over this with her, and she wanted to do this regardless, even though she had some periodontal problems with some of the teeth that I needed to take out teeth and bring these periodontally involved, or this 6-year molar forward in that gap. And if she had been a smoker, I would have been afraid to even start this case, but she wasn't, and she was taking care of her teeth good. And so let's see what this, looking at the models, you can see the upper jaw is too small. It fits inside the lower jaw. This kind of indicates a mouth breather, in addition to being class 3 and keeping the tongue in the lower arch while you breathed above it, but she didn't have the high vertical area in it, so I'm not sure that was totally wrong. So here we're coming in, and we're going to take out these 6-year molars on both sides. Now we're going to bring these teeth back. That's through the bicuspid into part of the space here, and bring it back where they should be as best we can pick up from that. Carry this back and not just lean them over. The teeth are going to be tilted forward in here as we bring them back, and begonium that's sticking out here, we thought we'd have to take it off, but it looked perfectly fine and when we finished. And then we would come and bring these teeth up from the back when we got these to there. Now they're forced to bring the lower anterior teeth back. We hooked up here and wore elastics to bring this back in this direction. So this is pulling the upper teeth in a forward direction while we're pulling the lower teeth this way. So to move these teeth way out here somewhere, we had to run interference, and so we wore a lip bumper that went back here and protected this and let us have a soft vascular bed here as we move the teeth out that let bone form. As the teeth moved, bone, teeth, and all moved in a forward direction while we were doing this. And you can watch this and check it out. And it is held up for 37 years from the time we started this. And now this was 2 of 87, I think, when these models were made. And I've got some pictures on her just about a month and a half back here. She was visiting back in, and we knew her, and I had a good friend that was a good friend of theirs. She took her picture, and so I've got that picture to show you. 37 years out from the time we did this case. Now let's go ahead and get started with it. She had a problem. We've got to widen the upper arch out, and we did that with a large arch wire. This is a 040 wire, and we can take that wire and go out like this and get all the lateral force you want on it to bring those teeth out. And then you can put a rectangular arch in the slots and put some buccal root torque on the rectangular arch, and they add the other arch to carry the crown out, and you can move the teeth out this way rather than tilting them like that. You got to do this with a rectangular arch that she would be wearing also. So here we had another problem down here on the bottom. This tooth was turned sideways, and to rotate a tooth like that almost always strips the portion of the root will be exposed down there. Your attachment is messed up there. So we're going to take those teeth out, and we're going in anyway to do this. And we've got periodontally involved. Some of the lower teeth have a loss of bone structure when we started it. And we decided to go ahead and do this. She wanted to do it even if she lost the teeth that were involved periodontally. So here we look at it on one side. These are better teeth over on this side. This one has got some periodontal pockets around it, and we're taking out the tooth in front of it, which is on better tooth, but we needed this gap. And so we went ahead and took this out. Even if you lost this tooth, she wanted to do it. All right, so we're going to advance these teeth up to about here, and we're going to bring these back to about this point right here. And if you need extra force to bring the teeth forward up here, you can pull these teeth back and pin it. Put the little pins in the cortical bone here, and that won't let them come back any further, and pull this even out further where you're going. Now you're going to have to run your lip bumper in front of these teeth out here as you advance them forward. And I want to make that absolutely clear. Now here we're going to take this tooth and bring it up part of the way, and we're going to bring these back part of the way. So this is where we want it. And I'm forced to bring this back In other words, this coming back, this force is being used to pull these teeth forward, up above. And that way we get the upper teeth forward, we expand the arch. I've done worked with people where they did the double saw surgery and they had to spread it out, and they cut the upper jaw down to the center and spread it out and put it like that and let it fill back in between the center. And here we expanded the upper arch on its own doing this. And so now this is complicated stuff. If this is correct, and we did I've done a whole string of these cases, and every one have stayed with me. Good. I mean, you didn't have to be done over again unless we pull that periodontally involved tooth forward, and it looked like it was getting bad, so it slowed down for a while in there, but I kept on coming with it, and we got the tooth up in a forward position as far as it was going to go, and it had the same amount of bone it had to start. I watched it very close as we went. Now, this tooth is coming on up there. This will fill in here. This is not lost bone structure here. And we brought it forward like that. And she's aged 28 and 7 months, something like this. And we started, but from the time we started till we finished the case, it took about 2 or maybe 2.5 or 2 years and a little bit more to get it done. We rotated that tooth down here and it stripped. We knew it would. We told her about it. So, but it filled back in, and you can see the tissue. We moved it over and then torqued the root in on that. And we're coming back with these teeth, and we're bringing them down. We're bringing them back bodily. We had to do that with a heavier arch wire than we got in there now, for sure. So here she is further on down the line, and you can see we've got her jaw back looking pretty good. That tooth's about halfway rotated at this point. Now these aren't things that's just regular orthodontics that we did, but we expanded the upper arch. I think I showed the deal, and then brought these anterior teeth back to a certain point and held them. I didn't use a pin on this one, but some of them we would use a pin to hold them there. Now we're coming back with this, where we're going forward with the upper anterior teeth, the upper arch. We're carrying all of them forward. Now we're moving the anterior teeth here back to a certain point, and here bring this forward the rest of the way, and then coming in and advancing the upper jaw is what we're bringing these back with. So here we expand the upper arch. I've got this large arch wire in there, expanding it, and there's a rectangular wire inside of that. It's bringing the roots out where it should be. As best I can tell, this was a rectangular wire. We brought the teeth out with buccal root torque, kind of progressive torque, as we brought this back, filling that out. And on the bottom, we brought them up. Then we moved the bottom teeth forward. And I got his here. We torqued the root in, and the tissue filled back in a good bit around that tooth right there. Now here we're moving the anterior teeth forward, and we're going to put a lip bumper up above. I'm showing that in one of these cases, one of the views here. Now she put on a little weight while we were going, and then she didn't like that, and she took that off again. Now, here we're bringing that out, and we're going to put a lip bumper. And you see we've expanded this lip bumper, and we ran interference for these front teeth as we brought them in a forward direction to let the bone structure go with us as we moved out like that. And that kept the left space in between the tissue and the lip bumper, so these teeth could move out in a bodily form like that, and both the lower teeth underneath. And so this was somewhere around 89, 11 of 89. We were just about to finish it up. And this lip bumper, you see we've expanded it as we brought these teeth back. In the lower, we pull that back, and it brought the back teeth up to the front. And then we're getting pretty close here at this point. The lip bumper, we used it, we've opened it out. As we brought the upper teeth forward, we lowered this, opened this up more, and that brings that, we were pulling the upper teeth in the forward direction. Now this is, it was 87, this is 5/24 of 90, so we've gone over 2 years. It was more than that, so that's kind of wrong on your deal. The space down on the bottom now is just virtually closed together at this point. Now we take it out, and I don't have the date, I can't read it under there. We finished the upper, we put a retainer in there to hold it in position, and we put a little bite plate where the teeth fit into that gap, and this was January of 91. We had that, and so we started 87, so we were way over the 2-year deal, but we were looking good. And this, now we're closing this gap down on the bottom, and this tooth that was turned around is looking fine. We got the root torque back in the bone on that. And here she is in 1991, and we have finished it out like that. Now, this is 87, and that's 91. So it did take us over 2 years. It took longer than that to do this. And the bone structures up above looks good. We're wearing a retainer in it, holding these teeth in place right here. She needs to scale her teeth better, but anyway, it looked like that. That's 91. From the side, we're looking at the way, and this was in a crossbite, like both sides was in over here. The upper's out over the lower, and this arch was being expanded out where it fits over the lower teeth. Here it is, 91. That tooth is rotated correctly, and that space is closed up. Now, this picture here was taken, it was my finishing picture. This is maybe 15 or 20 years after we finished the case. And then she came back, and it was in town here about a month and a half or 2 months ago, and my friend, I said, be sure and get her picture made. And so the profile looked like that, and it's been holding up all this time. And then the teeth look like this. She brushed the heck out of them. The cuspid roots look like they're exposed slightly, and they need to be scaled better. But this is holding up all these years. Now she came back. Let me show you here just a little bit. We have a picture of her just a few weeks back, and that's the way it is. Now the Pagonian, we thought we would have to come in and do a genioplasty, but after we finished, the teeth are pulled back here. We didn't just tilt them back, we carried them back bodily, and Pagonian is still out here, and you can see that. Now this is, I didn't get that date on that exactly. Right there, the upper wisdom teeth are dropping down behind there, but they hit a little bit, and she hadn't had to take them out since then. Now that is, I can't get the date on it, but here's the models back at January 7 of 2010, and the way we looked, the way it was holding, it lost a little bit of the space that we had won, but it still looked good. That's 10. Now here we widen that arch with the old 4-0 wire, and it's held up. Now, here was where we started in 87, and there's where we ended up. The profile is about as ideal as you could get, and it didn't increase the vertical height of the face at all. Now, that's, I don't have the date on that, but she got back, she came into town and her friend took this picture. She's gray-headed now. This is 37 years from the time we started this case, and it's still there, and that's the way she looked. So I am saying, if I am correct on this, that this is just as good and so much better than operating on both upper and lower jaws. This operation up above is a really bell ringer. I have scrubbed in on and watched and helped even do this, but this is so much better for people to do, and we didn't have to trim the chin back at all. You know, it was like that. We look at the profile here like that, and so I hope that you will examine, take this to wherever you want to. The ADA, no, this can be done. I've got about 12 cases behind this, backing it up and backing this up. And I find nothing at all wrong with this type of thing. You can pull these teeth on the bottom where you want them. You can put a pin in it and hold them there and advance the upper wherever you want them to be, and you can hold it at that point. But you got to wear a lip bumper to allow the upper teeth to come out that far. So I hope you'll go over this and look at it and decide that this is something that should be done. And I'm sorry to take away some of the surgical procedures that are so costly. Nowadays, this double jaw surgery would be way up there. And so this is so much better and so much safer to do. So thank you for watching, and I'm going to sign off and hope that people will examine this and decide that this ought to be taught in the schools all over the world, wherever we are thinking about that type of surgery. So I'm going to say goodbye, and I'll sign out here, and